Hello, Doc.
Hello, Doc.
Great conversations and education on relevant health issues management. Hello, Doc.
Hello, Doc.
Make a date with our health professionals on the drive with the area gang. Hello, Doc. Hello, Doc.
Hello, Doc.
Okay, so you welcome back. This is PLUZZ 89.9 FM. Dr Emefa Dzide is here. Good afternoon, Doc.
Good afternoon.
And we have to inform listeners, right, that Hello, Doc will be going on a break. And so today will be our final session with Dr Emefa Dzide until subsequently. When we come back. So let's not take all the apport we can get from her today, and we'll see how it goes from here. But you're welcome, Doc. Today we're looking at technology and health. I wonder, if we say technology and health, what exactly do we want to focus on? Is it the use of technology in health services? Is it how people individually use it? You know how these days it's actually very common for people to go online and do some research, and then all of a sudden overnight they become doctors, right? I don't know if you have such patients coming to you when you're talking to them and they are diagnosing their own illness because they've been online. So what's the focus on today when we say technology and health?
Yes, so today we are focusing on, let's say, the general public, the lay person, and their use of technology with health, not the professionals.
Okay.
Yes, so you as an individual who is not a health professional, how you would use the technology you have on your phones and other devices to monitor or to take care of your health.
Okay. Let's break it down then. The first area I want us to use because it's very common now for people to use smartwatches, fitness trackers. I use it. I use it on my morning walks, to check the distances, check the calories that I've burnt, and all the other parameters that it will give you. But sometimes I really wonder how much we can trust such devices. Are fitness trackers, smartwatches, are they actually accurate? Can we trust the numbers? If they say you've burnt how many calories, can we really trust these numbers?
Well, let me say, you can trust them to an extent. They are good enough, let's say, for a general use.
Okay.
Yes. So if you are just monitoring yourself, monitoring your trends, today I was able to do this, tomorrow I hope I can do this, planning and all those things, yes, that's fine.
Okay.
But you don't use it to diagnose conditions.
Okay.
Yes. So you mentioned calories and all those things. So usually in those calculations, they make generalizations. They use what the population generally would, how much they would burn, average in those kind of things. But when it comes to you as an individual, there might be subtle differences because of your personal metabolic rate, your diet, something that's peculiar to your environment where you are. A lot of these items that are made, they are not even made within the country, so they use other populations.
Yeah, they're not even using like Africans in general, talk less of Ghanaians.
So they might vary in like specific values. So you don't really use that to determine like diagnosing a sickness or something. But yes, you use it to monitor yourself. There are things, maybe if it's a heart rate monitor, if you're at rest, relaxing, fine. But then if they are like very high numbers, very low numbers, you can't really trust them. You have to get to a professional and use an actual professional device to test to confirm those kind of things. So when they tell your heart rate or your heart rhythm is abnormal and all those things, you have to go to hospital and let them actually use the correct equipment to check. Don't just diagnose that I'm having heart attack because of my phone is telling me.
So on a general note, we don't go to the hospital every day. On a general note, on a day-to-day basis, we could use these things.
It's
but
fine to monitor.
Yeah, to monitor.
Yeah.
But where you are having maybe abnormal figures or something, then you don't say that, you diagnose yourself and then probably even look for medication because you can do that online as well. So if I have this problem, what medication should I take and all that? You don't do that.
You don't do that.
Okay. Now, let's move on because I just mentioned it also. We have a lot of people searching for symptoms online before even they go see a doctor. What's the biggest problem with this practice?
So the biggest problem is what we call health anxiety, and then let me use a big term, catastrophic thinking. Yes.
Catastrophic thinking.
Yes. So you would read something, and then because of that, you would decide that yours is like the worst possible diagnosis. And a lot of times they give you a lot of information. So sometimes you'll be like headache and you go and search for headache, then you see that it's a brain tumor. But actually the commonest cause of headache is tension headache. It's not brain tumors. Yeah. So but you will read it and then you think the worst condition is your condition. So there's a lot of anxiety that those things cause, and sometimes they actually downplay some of the symptoms. So you might be having a serious condition, but then you read and it will tell you that, oh, this is nothing. And then you sit down with your symptoms before you realize it has actually developed into something bigger. And so there are a lot of like errors that can be made with those kind of things. So you can use it. I don't say we shouldn't use it, but use it with caution.
Okay.
Yes.
Because I was actually going to ask you if the advice would be for people to use it or not to use it.
Okay. Yes. So I advise you to use it, but use it thoughtfully. Don't just take the first thing and then that is the law. So you should before even going online to search, note down your symptoms. You are having headache, stomachache. What time are you having these headaches? After what activity what triggers do you notice? What's the severity? Is it very severe or mild? And then if you think it's something that requires immediate attention, then you don't have time to search. Just go straight to the hospital. But if you do search, okay, you use as many details as possible from your symptoms, and then you go to reputable websites like Mayo Clinic, Cleveland Clinic. You can go to CDC, WHO websites. Okay. Those are standard that we are sure they will not misinform you. And the focus should not be on diagnosing yourself per se, but just to understand more of the symptoms and then what the possibilities could be, and probably what you should do, what you shouldn't do in case of this. So, and always common things are common. So don't diagnose yourself of the rare condition that they mentioned. Yes.
Stick with the common ones first, at least.
Yes, stick with the common ones first. So you can read up. There's nothing reading. Even it actually helps you so that when you get to the doctor's office, you are prepared. You know what kind of questions to ask. So when you're having pain in this part of your stomach, you can search on the internet. So what organs are in this part of my abdomen? Then they'll tell you, oh, it's your liver that is here, or is this. So then you can ask, oh, doctor, do you think maybe it's a kidney problem? Do you think it's a liver problem? Those are good things you can do with the searching online. You can do deep dive. Even after you have been diagnosed, you can go in and look through. The doctor mentioned this diagnosis, he mentioned this medication. You can go online and research and then see maybe side effects, something that maybe your doctor may not have caught. So it's not a bad thing, but you have to be thoughtful about the way you use it.
I think I do that when I go to the hospital and doctor prescribes something for me. Usually I would go back and try to look at the drug, for instance, look at the active ingredients, look at what it does in the body and all that, to understand it, so that if I have subsequent questions to ask the doctor, I can do that. So yeah, that's good use of it. But let's come to this other practice. You know, these days, I don't know, there's blood pressure all over. People are having sugar problems all over. So we have these self-monitoring blood pressure and blood sugar that we do at home. Are there any associated risks or dangers from doing that as well?
Okay. Generally, not really, unless maybe there are problems maybe with the device, maybe it's not well calibrated, maybe the cuff size for the BP monitors, the cuff size sometimes is too small for your arm, so it will be giving you high BP readings, but probably because it doesn't fit your arm very well. Sometimes the technique with which you are using it, the level of the table where you place it before you measure the BP, and sometimes people have what we call reverse of quite cold hypertension. Is when the high BP only comes when they come to the hospital. When they go home, the BP is normal. People have the reverse of that. When they are at the hospital, the BP is normal. When they are at home, they get anxious and the BP goes up. So those are things that maybe you might get certain readings on your BP that you might be worried about. And the sugar machines, you have to be you should be trained and know how to measure the BP readings correctly. The blood sugar levels correctly, because sometimes if you are using the blood sugar level to determine how much insulin you inject yourself, if you don't use it well, you might overdiagnose or underdiagnose your sugar level, and then that might affect you.
Okay.
So yeah.
Okay. Let's come to the health apps that we have as well. I know there are thousands, if not millions, of health apps out there. How do people actually know which ones are good and which ones we need to avoid and all that?
Yes, so this is where you have to do a bit of reading. So don't just read the name of the app and then what you want to do. You have to look at the institution that is producing the app. Some are WHO apps, Mayo Clinic apps and other things. Some are also just some unknown individuals who are just producing the apps with no medical backing. So you have to really look into who is producing the app, check their data security and privacy settings, and sometimes you can see if they are FDA approved as well, and then see if the information they are using is evidence-based or they are just using, I don't know, hearsay or whatever. Sometimes people just make up their own things, that if you use this to measure this, then you lose this amount of weight and all that. They'll make some wild promises, and then you hurriedly use the app and you realize that
it doesn't work that way.
It doesn't work, yes. So, and then the reviews, so people usually read the reviews, but there are a lot of fake reviews and all those things. And those who are giving the reviews, most of them are not medical professionals, so you can't really trust reviews per se. So just read a lot in the details of the app to get to know who is producing it, and then the claims, the medical claims that they are making about it. But the good ones you can use that are safe are reminders for taking your medications, tracking your symptoms, and then the mental health apps that give you just advice about what to do in certain situations if you're having certain emotional issues. Those are quite helpful.
Okay, all right. And I know you've dealt with patients who probably are using technology the way we say we're talking about it, or maybe they're using it wrongly. What's the biggest technology mistake that you have seen patients making with their health?
Okay, so they would ignore their symptoms because the tracker is telling them they are fine. So the tracker is telling you your pulse rate is this, this is that. But then you are feeling unwell, you are feeling weak, you are feeling exhausted, you're having palpitations. So you feel your heart beating fast, you check it and it tell you your heart rate is 64. So 64 is normal, then you sit down. But the fact that you are feeling that heart beating is abnormal. So you don't just say the numbers are okay, so you ignore the symptoms. So that's one very important thing. And then people too would treat abnormal things as if they are normal. So you see like a fluctuation of your BP or something, and then you think, oh, it's normal. You should always, the best thing to do is when you're monitoring, you should write it down and then you look at the trend, how it's going. And it's easier to detect that something is going wrong that way. But if you just check it every day and then you close, then the next day you come and check, you will not really note if there's a trend going on. And then people also ignore the context. So they focus on like what the app is telling them, and then they ignore probably things around. So maybe they are feeling fatigue and whatever, and then they will look and then it will tell them maybe you have cancer, you have this, but they are ignoring the fact that they are not sleeping enough, they are not eating well. There are other simple things that are actually causing the symptoms they are seeing. But then they ignore those things, and then they'll
because the app is telling them this. No, that's what it is.
Yes. So you just have to think, be thoughtful about using the apps and stuff that you are using. We'll
be wrapping up, so we want to take some tips from you on using technology to stay healthy. If also there's some technology out there that you want to recommend that people can use and at least be on the safe side, let's take that with the tips that you give us on using technology to stay healthy.
So as I mentioned, using the apps to monitor your symptoms, monitor your BPs and the other things, those are very good. There are some that automatically put it like in a graphical form and all those things. Those are very helpful. We have the sleep trackers that help you track sleeping disorders. So those ones, you can just put it on record when you want to lie down to sleep, and then it will tell you if there were any snoring or anything. So even if you live alone and you don't know if you snore, you can use the sleep tracker. It will help you. Might even diagnose something. Yes. So and then when you are using the symptom trackers, use from very good sources, and then put in as much as possible. Sometimes you can even use these AI, Gemini, and all those things. But then put in as much information. So you put in, oh, I'm a 24-year-old man living in this country with this symptoms for this number of days. If you actually give it enough details, it can actually give you very good differential diagnosis, what the possibilities could be.
Okay.
Yeah, better than just Googling one.
Just putting in headaches with you. You can get headache from a lot of things, you know.
Yeah. So the aim of the technology is to help you to become a partner in your healthcare and not your own doctor. Because doctors, there's a lot of studying that goes into it. There's a lot of things that we consider when we are seeing a patient. And maybe you might not think of certain things that we would think of. But if you use these things, you can partner with the health professionals to get the best results for you. So that's, I think, the most important tip. So don't be so eager to diagnose yourself per se, but you get as much information and document as much about your sickness so that you get to the doctor's office. Once you just give them all these details, within 5 minutes, they've seen the problem, they examine you, and then you're done.
It's not for anything that somebody has to spend 7 years plus in school to undergo all these studies, come out, go through housemanship, do whatnot, go through specialization, everything. And you want to use 5 minutes, get on the internet, and then you want to become an overnight doctor. I mean, I get a point that we can be partners in the health delivery. We can be partners in supporting doctors to do their work, because sometimes, you know, people go to the hospital, they can't even tell the symptoms right to doctors. If they ask how they are feeling, they can't really tell the symptoms to that's difficult, you know. You say you have a stomach ache, and they will ask you which kind of ache. But you just know just stomach ache, you know. So I guess technology will help us in being good partners in the health delivery. Thank you very much, Doc, for coming on the show. We're going to miss you for a moment. But hopefully we'll get you back some other time. But thank you very much for coming on the show today.
Thank you.
All right. So that was Dr. Emefa Dzide joining us here for health. That is Hello Doc, which comes up Wednesdays on the Drive with the Area Gang. Like I mentioned, it will be going on break.